Welcome back to another episode of Board Bitesize. Today we are joined by our new Chief Executive, Jim Austin, and our Chair, Julie Holder. We have just finished October's board meeting and stepped outside to reflect on what has been discussed today, in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities, and focus on the future.
So Julie, it's Jim here. It's the first full day as Chief Executive for me in our public board meeting. Had a great day, and you and I are just going to spend the next 7 or 8 minutes just going through 4 parts of that board and the way we've made up. I'm going to start with people at the centre, one of our strategic themes obviously. And, you know, we topped and tailed the board meeting, starting with a really powerful staff story where Jess and Claire came to talk about the work they've been doing in Amber Valley and the community team there, and how they have really tried to make space for each other, to look after each other, to take time to look after each other, and then how that's then rolled through into things like sickness absence actually in their attendance, but really also in the quality of care they've been able to give, and how it's changed the morale and look of the team. So that was really interesting. We tailed the day by you and I signing a pledge around the admin charter, where Hazel and Emma had come along to talk about some of the work they've been doing over the last 6 months. Actually started in unison land, as it were, but that we've developed and adopted across DCHS. And while the charter is specific to our admin colleagues, and there's over 600 of them working in DCHS, we agreed as a board that the principles that sit there apply to all our staff, and as part of the wider people promise that we're undertaking across the NHS, we'll see that flow through.
Yeah, I think it's been a great day, and those 2 stories, if you like, really exemplify our concentration on people being at the centre of what we do. I just wanted to talk a little bit about partnerships. It was the focus of my board report this time, and I talked about the behaviours and energy we put into friendships, which for me are similar to those that we need to put into our partnership working arrangements. Honesty, respect, trust, working through conflict. Also this time, my visits with community nursing in Swaddling Coast and public health nursing absolutely blew me away this month. But it absolutely showed me how important it is for us to work with multiple agencies and the impact that makes on the outcome, but actually the impact it has if we don't all work together, both in terms of our communities, patients, but our staff as well.
So you're absolutely right, Julie. I think if I move on to the third quadrant around healthy communities, I've got a slightly sore left arm where Michelle Bateman helped me to pick up my flu jab, and we talked a bit about vaccinations, not only across the trust, but the programmes that are running out nationally, and how we want to make sure we're trying to get into the areas we don't normally get. We're doing something around informed and information around why we want to undertake that within the trust, and it was a great opportunity for the board to have the opportunity to be vaccinated. Within the board report that I do, there was some reference to Mpox, and we've had a number of warnings around that nationally. We had actually, I didn't raise it at the board, but we had a bit of an incident recently where one of our urgent treatment centres thought they had a case through, dealt with it very well, very effectively, got back up and running very quickly. So just understanding healthy communities broadly. I think the other bit that we focused on a bit today has been our Community First team. We've had a number of stories around there, and that interaction between social care and health, improving the experience for citizens in Derby, has started to come through really powerfully. And one of our non-exec directors, James Riley, had been to that directing board yesterday and have been out to see the team in action. So we talked a little bit about that too.
And I think it refers back to our people at the centre, because one of the questions that we had was, how are people feeling? And we were able to say at the moment people are feeling really positive.
Yeah.
And finally, but not least, our 4th theme is about looking to the future. Much of the last few months for you and I particularly, but also today's agenda has concentrated on the mission-led approach of this government and actually the outcome of the Lord Darcy findings, which will shape the next year's plan, but will also shape the next 10-year plan. So the aim to shift care closer to home in communities and have a focus on prevention rather than sickness is really consistent with our strategy and our values and our plans. and your report today was able to demonstrate this. And also, though, we've asked the board to consistently reflect on our approach to quality improvement and the fact that we should be role modelling our 8 QI principles. But also, latterly, in the last part of the agenda, we were talking about making time for teams to actually take time for their well-being, but also creating time to think about how they can improve their services.
And I think I'd just say, so one of our non-execs, Kay Fawcett, talked about the teams that need most to make that time are often the teams under the most pressure, and as a board we've taken away that responsibility to try and find space and permission for them to do that. We talked about a particular service where we're making an intervention to do exactly that, but I appreciate that colleagues listening to this will think, oh my goodness, I'm so busy, how on earth can I take time to think and do those things? We as a board are committed to trying to help with that.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.